Now, the first thing to discuss is about the tooth development and the eruption of tooth. Okay. The alveolar cavities which contain teeth are formed around third or fourth month of intrauterine life. At birth, the rudiments of all the temporary teeth and of the first permanent molars may be found in the jaw. Teeth are useful for age determination by the state of development and by the secondary changes. Now we have to first discuss about the anatomy of a teeth. Okay, what does a teeth look like? What does a tooth look like? So this is the crown upper part that you see, the neck which is embedded in the gums, and the part which we cannot see is the root. Okay, so the uppermost covering is the enamel and then the dentin. We have now the pulp cavity where vessels and nerves are present. Now the lowermost part is the gums which covers the teeth from the below, and above that is the cement. Okay. Now how to differentiate between the temporary and the permanent tooth? Okay. The temporary tooth are smaller, lighter and narrower, but the permanent tooth are heavier, stronger and broader. The direction of the anterior teeth are vertical in temporary tooth, but they are more inclined forward in the permanent tooth. Temporary tooth are china white in color and the permanent tooth are ivory white in color. Temporary tooth are more restricted, their neck is more restricted, but the neck of the permanent tooth is less restricted. And the roots of molars are smaller and more divergent in temporary tooth, and the roots of molar are larger and less divergent in the permanent tooth. Okay, so these are the basic difference between the temporary tooth and the permanent tooth. Now, temporary tooth. We will discuss about the temporary tooth. Also, they are also known as deciduous teeth or milk teeth. They are total 20 in number, 4 incisors, 2 canines and 4 molars in each jaw, as you can remember by the formula 2102. Okay. Now, the appearance, we will now discuss about the eruption of the tooth. The central incisor in the lower part, it erupts at the age of 6 to 8 months, and the central incisor upper part, it erupts at the age of 7 to 9 months. And the same likewise, the lateral incisor in upper part, it appears at the erupts at the age of 7 to 9 months, and the lateral incisor lower, it appears at the age of 10 to 12 months. Then the first molar appears at the age of 12 to 14 months, and then the canine appears at the age of 17 to 18 months, and the second molar, it appears at the age of 20 to 20 months. Don't get confused, because I have made a trick to remember that easily, which we will see in the next slide. So now, for eruption sequence of the deciduous tooth, we have to arrange them in the same order like this. The central incisor, the lateral incisors, the canines, molar, first molar and the second molar. And in the same part of the upper jaw, the incisors, central incisor, lateral incisor, canine, first molar and the second molar. Now you have to write 6 below the central incisor lower, then 12 in the next incisor, then 18 at the canine and 24 at the molar. Now just add, continue 6 plus 6 plus 6 and you will get the approximate age in months. Like the central incisor lower, it appears at the age of 6 months. Lateral incisor lower, it appears at the age of 12 months. Canine appear at the age of 18 months, and the molars, it appears at the age of 24 months. Now the secondary molar. Now the first molar, it appears at the age of 14 months. And also you can follow this path. 6 at the age of 6 months, central incisor lower, it appears at the age of 8 months. Central incisor upper, it appears, and then the 10 months lateral incisor upper, it appears. Okay. And also there also another trick to remember this. You can follow this path, and this path is known as NXU path. NXU path. With practice you can remember this. Okay. I will make another say I will try to create another path like this, NXU. Okay. Now few important points to be noted are: first, at the age of about 4 years, there is usually spacing between the deciduous tooth. There is spacing between the deciduous tooth. That means the deciduous tooth gives space for the permanent tooth. Now, about 6th to 7th year, first permanent molar teeth erupt behind the secondary temporary molars. After this, the temporary teeth begin to fall off. So the age of mixed dentition is 7 to 12 years. This is an MCQ question. Between 7 to 12 years, 24 teeth are present. At the age of 14, 28 permanent teeth are present and there is no deciduous tooth. Now, this eruption sequence of permanent teeth. Okay, the first molar, it erupts at the age of 6 to 7 years. The most important point is that first molar erupts when all the temporary deciduous teeth are present. After that, central incisor erupts at the age of 6 to 8 years. Then the lateral incisor erupts at the age of 7 to 9 years. Then the first premolar erupts at the age of 9 to 11 years. Then the second premolar erupts at the age of 10 to 12 years. Then canine erupts at the age of 11 to 12 years. The secondary molar, it erupts at the age of 12 to 14 years. And the third molar, it erupts at the age of 17 to 25 years. Now the trick is that master is in power. People can't make mistakes. You have to take the capital letter of each word and put it like this. Like M in the master is for first molar, I is for central incisor, second I is for lateral incisor. Then the P is for premolar, first premolar, another P is for second premolar, C is for canines, M is for second molar, and third M is for third molar. Okay. Now, what is the period of mixed dentition? At the age of 7 years, there are 20 temporary teeth and 4 permanent teeth. Like, what are the 20 temporary teeth? 8 incisors, 8 molars, and 4 canines. And what are the 4 permanent teeth? That are the 4 first molars. Now, at the age of 8 years, there are 16 temporary teeth and 8 permanent teeth. The 16 temporary teeth are 4 incisors, 8 molars, and 4 canines. And the 8 permanent teeth are 4 incisors and 4 molars. At the age of 9 years, only 12 temporary teeth remains and 12 permanent teeth. Okay, so the 12 temporary teeth are 8 molars and 4 canines, and 12 permanent teeth are 8 incisors and 4 first molars. At the age of 10 years, only 8 teeth remains, 8 temporary teeth remains, that is 4 molars and 4 canines, and 16 permanent teeth are present at the age of 10 years. And at 11 to 12 years, 4 temporary canines are present and 20 permanent teeth are present. Now, how to differentiate between temporary and permanent teeth on an X-ray, that is an orthopantogram. See, if the tooth is temporary, the germ of permanent tooth can be seen underneath. So these are the permanent teeth, because you cannot see any germs of temporary teeth below them. But here you can see that permanent teeth are budding. Okay, so that's how you can differentiate between the temporary and permanent teeth on X-ray. Now, developmentally, teeth are divided into two sets. The super added permanent teeth, the teeth which do not have a deciduous predecessor, like they erupt behind the temporary teeth, like all permanent molars, they erupt behind the temporary molars. Okay. Now, super added teeth are 6 in each jaw. Now, other type of teeth are successional permanent teeth. They erupt in place of deciduous teeth. They are 10 in number in each jaw. The few extra points to be noted are: first, the the estimation of age from teeth give better results than skeleton. Like the skeletal development is not with the age as approximate as the teeth are considered. Okay. If third molars are fully erupted, it indicates that an individual is above 17 years of age. Third, the wisdom tooth, also known as third molar, it erupts first in lower jaw on left side and then on right side. Fourth, the tooth eruption in female may be of 1 year before that of males.